All right. Hello, everyone, and welcome to the Aligned Wellness Podcast. I am your host, Dr. Torrie Thompson, and I'm excited to dive into another episode with you guys. Last week, we talked about my personal story and how I started and really laid a foundation, and now I want to dive into the nitty-gritty. So we're going to start with really what is functional medicine, what are the pros, what are the cons, what are some of the drawbacks in the industry, where did it start, root cause, all of that, so that when we dive into root causes, mold, mycotoxins, all of that, we have a really good foundation of what functional medicine is. So really what functional medicine is, and this is my interpretation of it, is looking at the body as a whole. So rather than looking at the body in terms of if you have, joint pain, you go see a rheumatologist, or if you have hormone imbalances, you go see OBGYNs, or you have skin issues and you go see your dermatologist. And so rather than that, the body in functional medicine, you look at the whole because nothing is isolated. Nothing acts without affecting other things. So really it's looking at the body as a whole and how things are connected. And then really what it's doing is getting to the root cause of why something is happening. I think where Western medicine has gone very wrong is that we often forget the body doesn't just go haywire. So, if you're having brain fog or sleep issues or hormonal imbalances, why is that happening? Your body doesn't just go, you know what, tonight we're not going to sleep. Or, you know what, my gut, we don't need to worry about that. Or my thyroid, it's fine if it goes a little crazy. There's always a reason why that would be off. There's many reasons why, right? There's never just one, but it's really getting to the root of why are we experiencing these symptoms and what can we do to heal the body as a whole. And so functional medicine, really that's where it started. And so the thing about functional medicine is different is it's not just a supplement or, in terms of what Western medicine, if you have a diagnosis, you take a medication and that is it. In terms of functional medicine, it's full lifestyle changes. So we're looking at diet, we're looking at your stress, your sleep, your water, your toxic load, your gut. You're looking at multiple things and seeing how can we optimize this for this person to help heal the body as a whole. I will say, and we'll hit on this a little bit more, that one of the things that functional medicine is slightly turned into is treating the body very similar to Western medicine. You have adrenal dysfunction, here, just go take this adaptogen or this adrenal desiccated. You have thyroid imbalances, go take this thyroid supplement. And so it's just being really cognizant and mindful that we need to get to the why. What is the root cause that the body would have these symptoms and what can we do to heal it? The body is so amazing and it has such an amazing capacity to heal and to regenerate. It's just you have to have the right factors there. So it's really looking at it from a full system approach, nothing acts without the other, and then looking at it of what do we need to do in terms of changing our lifestyle to allow the body to heal. So in terms of Western medicine versus functional medicine, there's a time and a place for both. You break your arm, you need emergency surgery, you're in some sort of emergency, Western medicine, amazing for that. But where we've gone a little sideways is in the chronic disease and the chronic decline of our health. So looking at the body truly, okay, what do we need to do? You have diabetes, Western medicine, go take, metformin or go take this medication, but not so much in terms of what got you here. What do we need to do to change your lifestyle so that we can reverse this or get it into a much better state than it is now? So Western medicine, very reactive rather than proactive, where functional medicine is trying to figure out why, reverse or manage, and then allow the body to heal. So where did functional medicine start? So functional medicine started by Dr. Jeffrey Bland in the 1990s. So it's been around a long time. The ideas of functional medicine are not new though, right? He took the ideas of Chinese medicine and Ayurvedic and all these ancient healing practices that have been used more on the eastern side of the world and brought that together and started looking at the body as a whole, right? Really changed the way that Western medicine looked at things. And so he co-founded the Institute of Functional Medicine, which is, I think, the gold standard of education in terms of taking someone with a Western or allopathic background and training them to see a little bit more functionally. His concept really was root cause medicine. That was what he brought to the forefront. He was really looking at gut dysfunction and foods and toxins and how that played a role in disease and in disease state. So he really brought it to the forefront. And then I think since then it's gained momentum and gained momentum and gained momentum. And now, even really in the last 5 years, we're seeing a huge shift in terms of people looking at functional medicine rather than Western medicine. And I think a lot of people get to that point because of a story similar to mine, right? They're failed by Western medicine. Western medicine can't figure out what's wrong. Western medicine doesn't give them the answers they're looking for. And so they exhaust all avenues there and then decide to try something like Western or functional medicine. Functional medicine for most people is a last resort, and it's usually what turns the needle and gets them to feeling better, but it is not really the starting point for most people. Maybe more so now than it used to be, but for a long, long time, it was really a last-ditch effort. And so when you look at the big differences between Western medicine and functional medicine, really it's looking at labs. It's looking at testing. It's looking at the lab values. So perfect example is looking at blood. In classic Western medicine, if you go get your blood drawn, you're going to get this huge range. Vitamin D is an example. In the standard range is going to be 30 to 100. If you're at 31, you're going to be classified as, yep, your vitamin D is great. Anywhere in that range, you are check mark, you are great vitamin D, we don't need to worry about it. But in functional medicine, we look at things through basically an optimal range. Basically, where do we want to be? And the standard ranges are based off of the average American. I don't know about you guys, but to me, I do not want to be the average American. The majority of Americans are overweight, sick, not well. I want to be in the optimal group of them. So what functional medicine's done is taken a tighter window. So vitamin D in a functional range or an optimal range is going to be more 60 to 100. So anything in that range is optimal. Anything below that is suboptimal. We want to bump it. And so it's looking at it in these tighter ranges. And even if you're on the low end of that, do we need to bump it, right? It's not just looking at it, are you in range or out of range? It's where do you fall? Are you in the right in the middle to the upper end? Are you basically about to go out or go under? It's looking at it through a little bit more of a critical thinking lens and going, okay, what do we need to do to optimize this? And then it's figuring out why would that be? Vitamin D, very simple. A lot of times you're just deficient in vitamin D. But looking at something like liver or kidneys or the thyroid, not just going, oh, liver enzymes are a little high, maybe you need to stop drinking. It's going, okay, what would cause that? Is it stress? Is it your diet and lifestyle? Is it a toxic load? It's understanding the why something would happen. So you're just taking a deeper dive into the labs through the functional medicine range. And then we have a whole bunch of other labs that you classically do not see in the Western world. So this is things like toxin testing, mycotoxins, mold mycotoxins, environmental toxins, heavy metals, stool testing, looking for things like parasites and candida overgrowth, and looking at things like organic acids. What does your gut look like? What does your mitochondria look like? How are your vitamin levels inside the cells? So it's just a whole nother type of testing that generally you are not going to see in the Western world. Again, it's looking for the why. Why would something be happening? And oftentimes you're going to do multiple tests to see, is it X, Y, and Z that are contributing to the problem? What are the factors that could be contributing? So as we get into these really cool tests, right, that allow us to see how the body's functioning, are there toxins? Are there infections? Then from there, in functional medicine, we can create protocols that are going to help get rid of whatever that root cause is and allow the body to heal. So you're looking at how do we fix the problem and get the body to heal and rebuild and optimize, rather than just here's a medication, mask your symptoms, all is well. So it's a much longer approach. But I think in terms of healing and getting back to a state of optimization, it is really the optimal place to be. So with functional medicine and, holistic, holistic side and health coaches and all that, the industry's changed a lot. And so there are lots of pros and lots of cons of things that have changed. And so right now, some of the biggest issues I see are going at functional medicine very similar to how we would allopathically. So we touched on this a few minutes ago. And so that's really going, okay, if your adrenals are tanked, or your thyroid is off, or your hormones are imbalanced, the Western way would just be give a thyroid medication or give you some synthetic hormones. But the functional medicine way classically would be figuring out why. Are your adrenals taxed or stressed because of what is going on inside your body? Is your gut a mess? Is your diet a mess? Are you not sleeping? And then from there, going and addressing that and starting to allow the adrenals to heal. But what we're seeing a lot more of is, in this era of supplements, is kind of a pill for an ill approach supplement wise, which is no different than using a medication. So that looks like, hey, your adrenals are a little taxed. Go take this adrenal supplement. Don't worry about why. Just go take this adrenal supplement. That is basically the same approach as taking a medication. We see this with hormones. Hey, your hormones are low. Don't figure out why. Just go take some hormones. And so that's, to me, one of the biggest downfalls we're seeing is people using supplements as band-aids rather than actually diving in and figuring out why. Don't get me wrong, you can use these supplements as band-aids while you're addressing the why. While you're uncovering, sometimes, yes, you can use some adrenal glands or desiccated or some adaptogens or some thyroid support to help mask symptoms while you're uncovering. But to just use that as a here, there you go, you're going to feel better, is just a old school allopathic kind of Western approach. The other thing is, we are living in the time of influencer marketing. And with that, there are these magic supplements. There's colostrum, and there are probiotics that promise the world. I took this and my skin was healed, my gut was healed, I slept. And so there is a ton of influencer marketing that is making it seem like they have these answers again that are just kind of masking it and not really getting to the root cause of why we're experiencing those symptoms. So being really careful of that. You really want to work with someone that understands why this is happening and can start to uncover and detox and rebuild, and then you can get lasting results. If you use a thyroid or adrenal or hormone supplement, you're going to have to stay on it. It's not going to get better without uncovering the why. Something else that is problematic is that there are a lot of people that don't exactly know what they're doing out there, that just because they have big followings on Instagram or TikTok, you start to see that they have this ability to get people to work with them or to buy their programs or their detoxes. In reality, their protocols aren't great. They don't know what they're doing. And so, again, it's kind of that influencer marketing thing of being really careful of who it is that you're working with, what they're promising. So it's always, what are you uncovering? Are you really getting to the root cause? And then what is going to be done to start to rebuild the body? There's a million magic detoxes. I'm going to heal your thyroid, your hormones, your gut, all of that in 60 days. If you're truly going and healing something, you're not going to do it in a 30 or 60 day thing. It's going to take time. Something else that we see that is problematic is that people often think that they can just go back to the lifestyle that got them sick after they're done. I'm going to do this detox. I'm going to work on healing my gut. And then I'm going to go back to eating fast food. And I'm going to go back to not sleeping great and all of that. And the goal of what functional medicine is to me is really to teach people lifestyle changes, right? Because it's not just one thing. There's no supplement alone that can fix anything. There's no diet alone that can fix anything. There's no mindset work alone or trauma work alone that can fix everything. it's a combination of all of it. And then it's really figuring out, how do I maintain this as my normal lifestyle, right? And it doesn't need to be the super strict program that you followed when working on healing your gut or detoxing or whatever it is, but finding balance, still drinking filtered water and prioritizing sleep and eating organic and really clean and making that the majority of their life. I see too many times where people do really well, they heal, and then they go back to what got them there. And so it's really being like, how do we make this a lifestyle change for people? How do we make this where people are able to maintain it and stay healthy? And often people do, because they've been so sick and they've felt what it feels like to not feel great, that they're like, oh, I'm going to stay with this. But again, it's finding balance. And a lot of people, they tell them, oh, you just need to go gluten-free for 30 days or dairy-free for 30 days or sugar-free. And the reality is, a lot of people need to stay, some version of that, or some, whether it's an anti-inflammatory diet or gluten-free or dairy-free or grain-free, whatever that looks like for that person, as a 80% of their, day-to-day life forever. It's not something that can just be kind of thrown out the window. And so something that is really important too is remembering that it takes multiple avenues. It takes multiple things to be able to heal the body. So often we look at, oh, I'm just going to do this diet, or I'm going to do this supplement, or I'm going to do this nervous system regulation, or I'm going to do this insert here. And the thing about it is that when you do one of them, you can make progress, right? If you change your diet, you can make progress forward. If you take some supplements, you can generally move forward. If you do some nervous system and some trauma work, you can generally move forward. But really, where the true place of healing is incorporating all of that. We need our nervous systems to be calm and out of fight or flight. We want to eat well, eat an anti-inflammatory well that promotes healing. We want to take supplements that are trying to achieve what we're doing. And it takes all of these different things, sleeping well and clean water, all to come together to really get those lasting results in terms of what is going to heal the body. So really looking at it from multiple views, and then that's really where you make amazing progress. And don't worry about being perfect. It's tomorrow. If you're like, I'm going to start working on healing my gut, it doesn't need to be tomorrow you're perfect and you're working on my sleep and my water and all my products are clean and my cookware is clean and my everything is non-toxic. It doesn't need to be that. It's a work in progress, but ultimately you want to get to where most of those things are dialed in and you're working on all of that together to really get lasting results. So when we look at root causes, what are they, right? So people often are like, I hear about root cause medicine, or got to find your root cause, but what are they and what are they not? I think that's one of the more important things, is looking at what is not a root cause and is more of an effect, and what is. So root cause is, to me, the deepest that you can go. What could be causing these symptoms that we need to pull out, and then from there you can get the body to heal. So things that are not root causes are not SIBO. They are not leaky gut. It is not hormone imbalances. It is not adrenal dysfunction. It is not low minerals. Those, to me, are all effects of deeper root causes. Your thyroid doesn't just go sideways. Your adrenal glands don't just shut down. Your hormones don't just get off. There's always a why. And everyone's why is going to be a little bit different. And it's often not one thing. It's usually this plus this plus this plus this that's led us to this situation. So for me, the big root causes that I like to look for, one would be infections. So what we kind of umbrella, that's an umbrella term for parasites, for bacteria, for Lyme and its co-infections, for some of the stealth guys, things like, the Toxoplasma and Mycoplasma and some of the stealth guys. So infections, those guys are going to cause things like SIBO and SIFO. So SIBO and SIFO, so small intestinal bacterial overgrowth, Candida, small intestinal fungal overgrowth, to me, are not root causes. They are an effect of something else disrupting the gut. The next thing would be mold mycotoxins. So mold produces a toxin that is harmful to the body called the mycotoxin. And the mycotoxin is, to me, one of probably the biggest root causes that I see. And the reason it's such a big root cause is because it's immunosuppressive. So it brings your immune system down. So it can't regulate its own bacterial balance. It allows things to overgrow. It's highly toxic and it taxes the liver and the kidneys. So it can really set you up for high toxic load, poor detoxification, and brings the immune system down. Where we get these mold toxins, they're going to come from water damaged buildings. So having a roof leak, a bathtub overflow, washing machine leak, some sort of water damage issue that then created mold. And then you breathe that in and you've got those mycotoxins in the body. The other source would be food sources. It's no less toxic than the water damage source. And the big foods that we look at are going to be grains, so rice, oats, wheat, corn, coffee, and peanuts. Those are probably the big three foods. So mycotoxins are one of my favorite things to look at because they're often so stealth. People are like, I've never been exposed to mold, not a possibility, and usually you can find it. And then the other things would be toxins. So environmental toxins, so these are things like plastics, pesticides, VOCs from building materials, so that new smell, any of the herbicides, so glyphosate, atrazine, things in our water, things in our air, our cleaning products, all of those guys, and then heavy metals. Heavy metals are very different than essential metals. There's two types of metals. Heavy metals are things like uranium, cesium, aluminum, mercury. These are things that when they're high can be highly problematic. They're very different from the essential metals, things that we need to survive. Iron, manganese, cobalt, lithium, those guys we need to survive. So heavy metals. So that to me is probably the most common root causes that we're looking at. And so through testing, you can usually identify what is there. So my favorite testing would be looking at a stool test and a toxin panel. It gives us a really good idea. Are there any parasites or bacteria? What does the gut look like, right? Is the gut in a mess? And then what toxins are there? Are we dealing with any molds, any environmental toxins, any heavy metals? So if we can lay those guys out, it gives us a really clear action plan of, okay, we have to get X, Y, and Z out. Then we can rebuild the gut and then heal. And so for me, I'll say most detoxification really comes down to, when you're dealing with root causes, is one, prepping, right? You can't just dive into cleaning out mold or parasites or whatever it is without prepping first. So making sure the body can handle moving these toxins, moving these bugs. So that's the liver, the kidneys, the lymphatic system, all of your body's natural ways of moving toxins and bugs out, supporting them. Then we dive in to healing the gut, or to cleaning out the gut, diving into cleaning out the gut. And that's mold, mycotoxins, that's parasites, that's bacteria, that's fungi, that's whatever's there, cleaning that out. Then environmental toxins, and then healing leaky gut. And something that I see all the time is you just have to heal your leaky gut. That's what everyone says, right? You'll see it all over social media. And so when you're dealing with leaky gut, you have to figure out why. Your gut didn't just say, you know what? I'm going to open, right? Our gut should be nice and tight. Nothing gets in, nothing gets out. That's not supposed to. But there's some things happen and cause the gut to open up. Now, food and bacteria can move through the gut into the blood. And so if you're just trying to heal the leaky gut, but you haven't cleaned out the gut or figured out the why, you're essentially healing road rash without cleaning out the rocks and the debris and all of that. So what we want to do is figure out what is there that needs to be cleaned out. Then we can get the gut to heal really, really nicely. So that's something that I see more often than not, is just heal your leaky gut. That's it. Just heal your leaky gut and it will solve all your problems. And yes, there is such a tie to having a healthy gut, to an overall healthy body, to a healthy brain. However, if you haven't fixed the why, then healing a leaky gut is an uphill battle. You're going to make very little headway. I see this all the time where someone will come and they'll start working with us and they will tell us that, you know what, I've been working on healing my leaky gut for 2 years and my symptoms are still here. That is definitely, you're not on the right track. If it's taken years to get somewhere of healing your leaky gut, you haven't figured out the why. You haven't uncovered the why and cleaned it out. So really always going at those root causes the deepest that we can possibly go. And then tracking your symptoms, right? So that those root causes that I talked about, those are a great starting point, but sometimes people have different root causes. They need to look at different things, deeper things, viruses, other infections. And so if your symptoms aren't improving and you're working on those, then sometimes you need to go deeper. Is there Lyme there? Are there some of these other infections? Okay, let's test for that. And it's just building off. Your symptoms should be improving. And as you're uncovering and detoxing, it should get better. You shouldn't be like, I'm 3 years in and I feel no different. So really, I really want to kind of hammer home, especially we're about to in the next episodes get into all of the individual root causes. We're going to go deep into parasites. We're going to go deep into mold. We're going to go deep into environmental toxins, heavy metals, opportunistic bacteria, stool testing. We're going to go deep into all of that. But something that I really, really want to hit home on is just test, don't guess, right? To know what you're dealing with is so helpful and so beneficial. And you need to look for these deep root causes. If someone tells you, oh, it's just your adrenals, maybe get a second opinion, right? If someone says, oh, it's just your thyroid, take the supplement, maybe look and see about getting a second opinion to figure out the why. Uncovering your why is worth everything. And again, it's not just one thing. It's very rarely just mold or just a parasite or just an environmental toxin. It's usually a layered approach of this, maybe a little bit of mold, which caused a little bit of candida overgrowth with some environmental toxins and some heavy metals and leaky gut. That's usually what it looks like. So really being mindful and making sure you're getting the full picture, and then just being patient. It takes time to heal. None of this stuff can be fixed quickly. It takes time. So hopefully that helped really bring some insight to functional medicine and root cause and how the approach, how many of us take the approach on working with people and how to heal. And just remember that healing is always possible. You just have to put the pieces of the puzzle together. So thank you again for joining me. Next week, we will dive more into the root causes, uncovering how these things affect us, where they're coming from, and what you can do about it. So thank you so much. And you guys have a wonderful week.